Frenkie De Jong of Barcelona suffered an ankle injury today that looked very consistent with one of those classic inversion ankle sprains. As of right now, we don't know a lot of details regarding the severity of the ankle injury. However, when a person suffers an inversion ankle sprain, like it seems to be on this particular injury, they're going to stress all of those structures that are located on the lateral or outside portion of the ankle. With today's video, we're going to talk about what causes an inversion ankle sprain, what structures specifically are stressed in this position, and the recovery time frame. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I also go over the relevant anatomy of those particular injuries and finally talk about what that person should expect when coming to physical therapy. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have suffered an inversion ankle sprain, go ahead and comment in the comment section below. So we see here that as De Jong is going to land, that ankle and foot is just going to get twisted up underneath of him, resulting in that ankle injury. Here I have a model of the foot and ankle, and so the ankle joint is formed by two long bones coming down to form either side of it. The first one being known as the tibia, also known as the shin bone, that's going to come down and form the inside or medial portion of the ankle. This particular section is called the medial malleolus. Then as we go towards the outside or lateral portion here, the fibula bone is going to come down and form the outside portion of the ankle, also known as the lateral malleolus. And then as we look further inside of the ankle joint here, we have the talus bone. And these three together make up what we know as being the ankle joint. Now let's go ahead and talk about the motions at the foot and ankle. The first one is known as dorsiflexion, and this is when a person is going to be bringing their foot up like this. The opposite of that is known as plantar flexion, where they're going to be pointing their toes downward. Then as we flip the model here, the motion where a person's foot is going to come in that classic ankle sprain is known as inversion. And finally, the opposite of that is known as eversion. Anytime a person is going to roll their ankle inwards into that classic inversion ankle sprain position, this is going to take them beyond their normal value of inversion. So everyone has a normal value that they can go through the ankle in the inversion position. Usually it's anywhere from about 25 to about 35 degrees. It really depends on the person. But anytime they're going to go beyond that, that is greatly going to stress the structures that are located laterally or on the outside portion of the ankle. There are three main ligaments that are on the lateral portion of the ankle that contribute to overall lateral ankle stability. The first one is known as the ATFL, or the anterior talofibular ligament. So anterior talofibular ligament means anterior, meaning that it's towards the front portion here. Talofibular, meaning that it's going to attach the talus and the fibula together. Then as we move slightly back here, we have the CFL, which stands for the calcaneofibular ligament. So it's going to attach the calcaneus and the fibula together. Then as we flip towards the back here, we have the posterior talofibular ligament, also known as the PTFL. Posterior, meaning it's towards the back. Once again, talofibular because it's attaching the talus and the fibula together. So anytime, once again, somebody goes beyond their norm value of inversion, this is greatly going to impact those ligaments that are located on the lateral portion of the ankle. It also puts a person at risk for a fracture. So as we go through here beyond the norm value of inversion, you can see that it's greatly gapping this area of the ankle, which puts it at great risk for a lateral malleolar fracture, as well as it's compressing the medial malleolus, which places that also at risk for a fracture. There has not been any update regarding a fracture in this case, but it's just important to know that anytime you go in this position, ligaments and bones can be implicated simultaneously. Anytime there is a suspected fracture, this is going to be ruled out, of course, via X-ray. There is an on-the-field or in-the-clinic test we can do that will help us rule in whether or not a person has suffered a lateral ankle sprain, and this is known as the Taylor tilt test. So what we're going to do is we're going to stabilize the person's leg and take their foot, and we're going to passively take them through inversion. Now, when we do this, if this reproduces the person's pain and the pain is located laterally or on the outside portion here, then this makes us think that they have in fact suffered a lateral ankle sprain. This test can be biased a little bit to essentially rule out one or multiple of those lateral lateral ankle ligaments. So if we take the person more into plantar flexion and inversion, this is going to bias a little bit more of that ATFL. If we put them more in a neutral foot position and go into inversion, this is going to be biasing more of the CFL. And finally, if we dorsiflex a little bit, this is going to bias more of that PTFL. The gold standard, of course, to show us visually whether or not the person has any damage to these ligaments is going to be the MRI, and this is going to take us into our grading system of ligament injuries. So in a grade 1 ligament injury, this is where you're getting stretching of the affected ligament. In a grade 2, you're getting partial tearing. And finally, in a grade 3, this is where you're getting that full rupture. Full rupture is absolutely the worst case scenario, and usually this is accompanied by a lot of instability at the ankle. So we'll wait and see the results of that MRI to essentially determine an accurate timetable for him to return. Usually when a person suffers a grade 1 ankle sprain, they're going to be out anywhere from 1 to 2 weeks. It really just depends on how they are presenting in the clinic. Anytime they suffer a grade 2, this is because they're dealing with a partial tear. This can be anywhere from several weeks up to a couple months. And finally, once again, because the grade 3 is the worst case scenario and they have a full rupture and usually that ankle is just very unstable, it usually requires surgical intervention. So in order to determine how long he's going to be out, we just need to wait and see the result of that MRI. As soon as I hear those results, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update us as well. So we wish De Jong the best of luck moving forward. We hope it's more along the lines of one of those low-grade ankle sprains. Thank you so much for tuning in to my channel today. If you like this sort of content, I'm going to go ahead and link another one of my playlists so that you can watch some of the videos that I've talked about in the past. Thank you so much for tuning in, and I'll see you next time.